Dr. Tony Weaver, and I'd like to welcome everyone to live. Today we're going to be talking about Botox. Botox is one of the most common procedures in all of plastic surgery. This is an exciting thing. One of my favorite things to do in all of plastic surgery. It can be so gratifying for patients who want minimal downtime and they want maximal results. We're going to help you answer the question, should I or should I not go for the Bo? And so what to know before you Bo. We use more Botox in our practice here than we do any other neurotoxin. Botox has been around now for greater than 20 years. It has many different indications. Botox can be used in plastic and reconstructive surgery, for cosmetic techniques. It has been used in colorectal surgery. It's been used in neurosurgery or neurology for muscle spasticity. There are studies about Botox. And so we've looked at it in many different ways. And Botox is a wonderful drug because it's predictable, and it has an expiration date on it, meaning that if you don't like the effects, those effects do wear off. If you do like the effects, then you can just get treatment again. And that's one of the great things about Botox. So Botox, in fact, it is a toxin. The way that it works, using a very small needle, what we do is we inject this neurotoxin or this medication into the muscle directly. And so when we inject, and here's just a really small needle here, you can barely even see it. It's that small 30 gauge needle that we use. We use Botox in many different places. We use it, as I mentioned before, for cosmetics. We use it for hyperhidrosis underneath the arms. We use it sometimes for spasticity. We use it for migraine headache management, which is a part of plastic surgery as well. So there's so many places that Botox can be used. And you want to go to a provider who not only is experienced in using it in cosmetics, but someone who knows the facial anatomy, who knows where those muscles begin and where they end, and who knows how to treat and correct issues when they arise. So using a small needle, as we mentioned before, Botox is injected directly into the muscle, and it acts locally right where it's injected to paralyze the muscle. There are networks and layers of muscles that perform different tasks. For example, in the forehead, there are muscles, as you can see as I'm raising my eyebrows here, there are muscles that elevate the brow. These brow elevators are muscles that lift the brow. So they lift the brow like this, they lift the eyebrows, they lift the upper eyelids. Those are called brow elevators. And one of the most common brow elevators, or one of the predominant brow elevators, is the frontalis muscle. And so when you look here, and that's exactly right, Candace, it's used for dystonia and other neurological issues. When we look here, we see a picture of someone who has what we call forehead rhytids. These forehead rhytids, or these forehead lines, they occur because of activation of the frontalis muscle. The frontalis muscle comes down and it comes from the back of the scalp and comes down and inserts on the skin on the forehead. And you can see here, when someone raises that brow up, it creates those wrinkles in the skin. And the way that you prevent those with Botox is you inject in the area of the frontalis muscle. I typically spread it out so you don't have any counter traction from some of the other muscles in the area, which can create deformities, very specific deformities, if the muscles are not actively treated in a very equal way, in a very well-balanced, symmetric way. And so these wrinkles in someone who's a good candidate for Botox, they completely eliminate those wrinkles. So you go from that to, a completely smooth forehead. My goal as a plastic surgeon isn't to make people look dramatically different. My goal is for you to be your best self. And so that may mean eliminating the majority of the lines. I have some people who come in and they say, Dr. Weaver, I want all these lines removed from my forehead. I want it to be completely smooth. And we come up with a treatment strategy with Botox for that. And then there are some people who come in who say, I'm a very expressive person. I want to be able to still animate and move my face. And so with that, we come up with a very unique individualized treatment plan for their Botox with that. I even have people who come in and they, even before, having procedures done on their brow. And so if they're going to have microblading or something more permanent, make an investment in their brow position and shape, we'll work together to position their brows right where they want it with Botox, and then they'll go and they'll have their micro blading and their brow work done. And that really helps you to optimize and get the best results for all of your cosmetic treatments. So that includes Botox, that includes brow work, that includes your makeup. And so all those things come into play when thinking about these things. And with Botox, we can even do a chemical brow lift, where not only do we eliminate those lines in the forehead, we can work to elevate the brow. So strategically targeting those muscles, we can elevate the brow to give an arch of the brow. And so I work on that individually for every single patient. And we can choose and we look at small asymmetries or uneven areas of the face and to balance those out to give you the best results that you can have while still looking and performing or moving and acting in terms of motion in your face like your normal self. Or typically lasts about 4.5 to 5 months. On average, I tell people that you should look to start touching up your Botox after about 3.5 months, because you don't want there to be a period to where your Botox wears off completely, and that's usually at about 4 months to 4.5. You want your results to be fluid. You don't want there to be any fall off in your results, and you don't want there to be any significant appearance of those wrinkles coming back. Now, Botox treatment in the office takes about 10 minutes in our office, and that's when you get in the room. So once you complete your paperwork, you can do most of that online before you arrive. And then once we get you checked in, I like to go over a detailed facial analysis and provide you with a cosmetic consultation, which is included as a part of your Botox injection package. And once we do that, then the actual injection part takes less than 10 minutes to do your injection. One of the only offices in North Alabama in particular, we create a minimum pain Botox injection experience for our patients. We do that through a couple of different techniques. Some patients like to use numbing cream, and for all patients, I use a device that minimizes the pain directly at the injection site, and it works by activating the nerve to help minimize and reduce the pain during your Botox injection. So we want your experience to be one where it's well informed. We want your experience to be one to where you receive the results that you want. And we also want it to be a pleasant experience. So minimizing pain, really encouraging you to ask questions and providing you with information that's going to empower you is what we do in this practice, and we take that very seriously. So again, Botox itself takes about 10 minutes to get it injected in the office. Doesn't really kick in though until about 5 to 7 days. Typically takes about 5 to 7 days before maximal effects occur. It depends on the density of the muscle and the amount of Botox that you get injected. So important to find a provider who's going to talk to you about treat to complete. You don't want an incomplete Botox treatment. You don't want an incomplete treatment with anything. And so it's important to find a provider who is going to talk to you about treat to complete. What that means in my office is treat to complete is when you come in. There are some patients who've gone to other providers. They'll come in and say, I only want 10 units in my forehead, or I only want 10 units and I want my whole forehead done. I want my crow's feet done. I want all around my eyes. I want my frown lines done. Well, that is impossible. It's virtually impossible to perform or to get a good result in all of those areas without using more neurotoxin than that. And so treat to complete is exactly what you have to do to get the results that you are really looking for. Typically in women, it takes about 40 units to do your forehead lines, to do your frown lines, or the 11 lines, and I'll show you a picture of those, and then to also do your crow's feet. So for 40 units, you'll get your crow's feet completely treated, you'll get your forehead completely treated, and your 11 frown lines here. And so an example of your crow's feet is in this image here. And so if you look here, these are those smile lines that come up. And so those come over time, but 5 units of Botox on each side totally eliminates those, and it eliminates them for that 4.5 month period. Another thing that we see in the center of the face too, I want to show you here, is your 11 lines. Those 11 lines come up, and if you look here, these 11 lines along here, those are those frown lines. So when you're upset and you make those frowns like that, those are the 11 lines. It takes about 20 units of Botox in this region to treat the procerus muscle in the middle, and then the corrugator superciliary muscles out in a V in that area. We use a very gentle touch technique. The vast majority of people don't bruise, especially when people are not on any blood thinners, when they're not on aspirin. I would even tell you to use extreme caution if you take aspirin, Plavix, Coumadin, or any blood thinners, because you don't want to get in a situation to where you cause significant bruising that's going to cause other problems such as a hematoma or bleeding, and really compromise your overall results or your health. So it's something important to note. Some other things that Botox works really well with for the pebble or cobblestoning of the chin. I use it here to provide greater definition along the base of the chin, injecting directly into this muscle here, the mentalis muscle. If you've seen people who have those dimples or those little pebble chin or cobblestone appearance in their chin when they make certain facial expressions, Botox works wonders for giving you a much more keen and defined chin. People with a boxy-shaped face, jawline, Botox works well with 50 units injected into the masseter muscle. So for facial contouring, for removal of the wrinkles in the forehead and the center of the face and crow's feet, so removal of wrinkles, facial contouring, all that is a part of what we do with cosmetic Botox. Another great thing that we do and we offer, I love seeing the results from this, or when people have a gummy smile. Just a few units of Botox strategically injected into a very, very specific place in the face will release those muscles and help to settle that smile down with very minimal to absolutely no side effects. So it is a great technique for that as well. So facial contouring, for wrinkle reduction, and also I want to emphasize wrinkle prevention. So Botox is great. What we know now, having almost 30 years of literature or research on Botox, we now know without a doubt that Botox does reduce and slow the development of facial wrinkles or fine lines in the face. And so I recommend that it all depends on genetics too, because some people can be in their 40s and not have any lines at all, and some people can be in their early 20s and already have early lines forming. So it depends on sun exposure, it depends on genetics, it depends on how often you make certain facial expressions. All those things factor into when or if you're going to develop fine lines or wrinkles in parts of your face. But Botox is a great treatment for anyone, no matter if you're in your 20s or if you're in your 50s. It works out really well for most patients overall. Now, I'm not going to tell you that Botox is a complete miracle drug, because that's not the 100% truth, because there are certain patients out there that Botox may give them a modest improvement. And I'm talking about patients who would either need a facelift or need a brow lift or need a much, much more invasive procedure. For those patients, Botox isn't really going to give a substantial enough result to really get them to exceed expectations. But for by and large, most patients in this day and age, Botox works well not only to achieve an improvement, but to achieve excellent results and to exceed those expectations. And that's what we are here for. My job is not only to help you set expectations. My job is to help exceed those expectations. The common side effects after getting Botox, it's headache. And that headache typically is a tension type headache right at the injection sites. And I tell patients they can take Tylenol if they experience that. Patients should avoid taking ibuprofen or aspirin because we don't want any bruising to occur at the injection site. I want to touch on a couple of more things since we're really still just on Botox, just in terms of post-procedure management or post-procedure care. It's smart after your procedure to avoid aspirin. You can definitely take Tylenol. And, there's some people out there that will tell you, don't go home and take a nap. I tell people most of the time, typically, because I'm very specific in using what I call micro droplet technique and injecting very specific muscles. So usually after about 4 hours, it's okay to lie down, to take a nap. After about 4 hours, it's totally okay to, in my opinion, to exercise, as long as you aren't doing, any type of significant yoga that may, put you in a position to where, you're putting a lot of pressure on a particular part of the face where you've been injected. And I always encourage people not to touch their injection sites. One, you don't want those little puncture wounds to get infected or get irritated. And two, you don't want to cause the neurotoxin to move anywhere other than right where your plastic surgeon injects it. This is Dr. Tony Weaver. I thank you guys so much for joining us, and I look forward to broadcasting again next week as we will be discussing discussing yet another relevant and engaging topic in plastic and reconstructive surgery. Thank you very much.